Hello everyone, my name is Armine Vardanyan. This is my presentation for Biology 033 class and the topic is called high blood pressure. First, let's define high blood pressure. According to American Heart Association, high blood pressure is when your blood pressure, the force of your blood pushing against the walls of your blood vessels, is consistently too high. Blood pressure is measured using two numbers. The first number, called systolic blood pressure, represents the pressure in your blood vessels when your heart beats. The second number, called diastolic blood pressure, represents the pressure in your blood vessels when your heart rests between beats. Blood pressure is measured in millimeters of mercury. It is considered to have normal blood pressure when systolic blood pressure is less than 120 mm of mercury and diastolic blood pressure is less than 80 mm of mercury. There is a risk for hypertension. This condition is called prehypertension when systolic blood pressure is between 120 to 139 mm of mercury and diastolic blood pressure is between 80 to 89 mm of mercury. And there is a high blood pressure condition when systolic blood pressure is 140 millimeters of mercury or higher, and diastolic blood pressure is 90 millimeters of mercury or higher. Let's look at some statistics. About 75 million American adults have high blood pressure. That's 1 in every 3 adults. About 1 in 3 American adults has prehypertension. Blood pressure numbers that are higher than normal but not yet in the high blood pressure range. Only about half of people with high blood pressure have their condition under control. High blood pressure was the primary or contributing cause of death for more than 410,000 Americans in 2014. That's more than 1,100 deaths each day. High blood pressure costs the nation $48.6 billion each year. This total includes the cost of healthcare services, medications to treat high blood pressure, and missed days of work. There are usually no warning signs or symptoms of high blood pressure. There is only one way to know whether you have high blood pressure or no, and this is with testing it. Risk factors include family history. If your parents or other close blood relatives have high blood pressure, there is an increased chance that you will get it too. Age. The older you are, the more likely you are to get high blood pressure. Gender. Until age of 64, men are more likely to get high blood pressure than women are. At age 65 and older, women are more likely to get high blood pressure. Race. African Americans tend to develop high blood pressure more often than people of any other racial background in the United States. Chronic kidney disease. High blood pressure may occur as a result of kidney disease. Having certain medical conditions can increase your risk for developing high blood pressure. These conditions include prehypertension, diabetes. Unhealthy behaviors can also increase your risk for high blood pressure, which include tobacco smoking, eating foods high in sodium and low in potassium, not getting enough physical activity, being obese, drinking too much alcohol. Controlling blood pressure. We can control it through diet. Eat a healthy diet that is low in salt, total fat, saturated fat, and cholesterol, high in fresh fruits and vegetables. Be active. Try taking a brisk 10-minute walk 3 times a day, 5 days a week. Do not smoke. These lifestyle changes for blood pressure control are similar to those for preventing high blood pressure. You can help prevent high blood pressure by making healthy choices and managing any health conditions you may have. Practice healthy living habits and prevent or treat medical conditions. Thank you so much for your attention, and here are the references. Thank you.